Safe vaginal birth really depends on the mother and what she does ahead of time to prepare for that. Some of the best things is to stop smoking, make sure you take your prenatal vitamins, and if I can just say something, what you really need to do is take your folic acid, because that prevents neural tube defect, which is the baby's brain not developing, and also it helps at the end to decrease SIDS. SIDS is one of those things that we can't predict, but we do know people who take folic acid before they get pregnant and during their pregnancy have much less amounts of SID. So a lot of the books out there, a lot of the information is wrong. Doctors do not routinely cut episiotomies, not at all. Back in 1991, they did a study, and it showed that women who are allowed to tear naturally with lots of help and support tore very little, and they tore in the natural tissue planes so that the nerves and the blood vessels went to the side. So people heal a lot better. So episiotomies now only occur when the doctor has to do an operative delivery to get the baby out quick. So those are, again, are rare, and just, we don't do them. We only induce at term, and there's big laws about that. We will not induce a preemie baby unless the baby's at risk. So for induction, there's a couple ways that we do it. One is some people are so dilated that we go ahead and just break their water and they go into natural labor. Other people, we have to ripen the cervix. We do that with some medicine that we actually put in your mouth. Other people use a Foley bulb, but all of them, for the first part, soften the cervix, and after that, we all use oxytocin. This has been done for 50, 60, almost 70 years now, and has not shown to be any problems with the baby or with the labor. Cesarean sections are things that we try to limit as much as possible. I got to tell you, regional is really good with keeping their C-section rates actually at or below the national average. The risk of having a C-section occurs, about 1 in 3 times. It's almost 30% through the United States. And, you know, the babies are too big, they have a bad position of their heads, and we let you try labor. We actually have ways of making sure that the labor is adequate a force, adequate a pattern for the contractions, and that we give you a good trial to make sure that we don't do a C-section for unnecessary reasons. One of the biggest questions that women ask if they've had a C-section, how does that affect my next pregnancy? Well, the truth is it does a little bit, but not as much as people say. Because you have a C-section, you don't need to have another C-section. In fact, we do something called vaginal birth after C-section, which almost everyone who has a C-section is a candidate for. There is a rare type of C-section we do under really significant issues that says that you can't have a C-section again. But those are rare, and that is not the usual. So vaginal birth after C-section is a really common event. We just watch it close. We want you to labor in the hospital. We do not want you to labor at home, but it's successful most of the time.